Hallucinations and hearing voices. Hallucinations are where someone sees, hears, smells, tastes or feels things that do not exist outside their mind. They are common in people with schizophrenia, and are usually experienced as hearing voices. Hallucinations are often frightening, but there's usually an identifiable cause. For instance, they will occur as a result of taking illegal drugs or alcohol, a mental disease, like schizophrenia, a progressive neurological condition, like Alzheimer's disease or paralysis agitans, loss of vision caused by a condition like degeneration. This is often referred to as Charles Bonnet syndrome. See your GP immediately if you're experiencing hallucinations. The recommended treatment options for hallucinations will depend upon the underlying cause. For instance, antipsychotic medication may help with hallucinations for people living with schizophrenia. Hallucinations can cause you to feel nervous, paranoid and frightened, so it is vital to be with someone you'll trust. The following information explains the standard sorts of hallucinations, including why they occur and what you'll do. It covers hearing voices, drug-induced hallucinations, hallucinations and sleep, hallucinations in children with a fever, Charles Bonnet syndrome, hallucinations in older people with delirium. Hallucinations also can occur as a result of extreme tiredness or recent bereavement. However, hearing voices within the mind is that the commonest sort of hallucination in people with psychological state conditions like schizophrenia. The voices are often critical, complimentary or neutral, and should make potentially harmful commands or engage the person in conversation. They'll provide a running commentary on the person's actions. The experience is typically very distressing, but it isn't always negative. Some people that hear voices are ready to accept them and obtain woe to them, or may consider them a neighborhood of their life. It's not uncommon for recently bereaved people to listen to voices, and this might sometimes be the voice of their beloved. Practical advice. If you're hearing voices, discuss any concerns you've got together with your GP. If necessary, they'll refer you to a psychiatrist. This is often important in determining whether you've got a significant mental disease. If your voices are thanks to schizophrenia, the sooner your treatment is started, the higher the result. You may also find the subsequent advice helpful. Talk to other voice hearers. The Hearing Voices Network may be a UK-based charity which will offer you help and support, and put you in tune with people during a similar situation to you. Be hospitable discussing your voices. Try to understand where the voices come from, why and what triggers them. Drug-induced hallucinations. Illegal drugs and alcohol. People can experience hallucinations when they're high on illegal beans, cocaine, LSD or ecstasy. They will also occur during withdrawal from alcohol or drugs if you suddenly stop taking them. Drug-induced hallucinations are usually visual, but they'll affect other senses. They will include flashes of sunshine or abstract shapes, or they'll take the shape of an animal or person. More often, visual distortions occur that alter the person's perception of the planet around them. The hallucinations can occur on their own or as a neighborhood of drug-induced psychosis. After long-term drug use, they'll cause schizophrenia. Some people take cannabis to calm themselves and relieve their psychotic symptoms, without realizing that within the long run, the cannabis makes the psychosis worse. Heavy alcohol use also can cause psychotic states, hallucinations and dementia. Medication. Various prescription medicines can occasionally cause hallucinations. Elderly people could also be at particular risk. Hallucinations caused by medication are often dose-related and that they usually stop once you stop taking the drugs. However, never stop taking the drugs without chatting with your doctor first and, if necessary, after being assessed by a psychiatrist. Speak to your GP about how the medication affects you, so you'll discuss the likelihood of switching to a different medicine. Hallucinations and sleep. Some people experience hallucinations even as they're falling asleep, hypnagogic, or as they begin to awaken, hypnopompic. The hallucination may take the shape of sounds, or the person may even see things that do not exist, like moving objects, or a formed image. Like an individual, the person might imagine they've seen a ghost. Hypnagogic and hypnopompic hallucinations are particularly common in people with narcolepsy. However, they will also occur in people without narcolepsy or any disorder. They are essentially like dreams, and in themselves are nothing to stress about. Hallucinations in children with a fever. Hallucinations can sometimes occur in children who are ill with a fever. Call your GP if your child is unwell with a blood heat of 38°C or above and you think that they are hallucinating. In the meantime, stay calm, keep your child cool and reassure them. Encourage them to drink many fluids and provides them paracetamol or ibuprofen. Always read the patient information leaflet to seek out the right dose and frequency for your child's age. And check they are not allergic to medicines you give. The hallucinations should pass after a couple of minutes. Charles Bonnet syndrome. Some people with visual defect may experience temporary visual hallucinations. This is referred to as Charles Bonnet syndrome, and it tends to affect older people that have begun to lose their sight, although it can affect people of any age. The hallucinations usually last for about 12 to 18 months and may take the shape of straightforward, repeated patterns or complex images of individuals, objects or landscapes. Some of the four most common causes of visual defect include age-related macular degeneration (AMD), where the central part of the back of the eye, the macula, which plays an important role in central vision, stops working properly. Cataracts, when changes within the lens of the attention cause it to subside to transparent, clear. Glaucoma, where fluid builds up inside the eye, damaging the optic nerve, which relays information from the eye to the brain. Diabetic retinopathy, where blood vessels that provide the attention become damaged from a buildup of glucose. In the UK, around 100,000 people are thought to be suffering from Charles Bonnet syndrome. Hallucinations in older people with delirium. Hallucinations can sometimes occur in frail older people that are ill. The hallucinations may start before other signs that the person is unwell. They may be caused by a chest infection or urine infection, for example,